This is a regional closure. It's based on the capacity of intensive care unit beds. And so the state has set a threshold of 15%. Reason for that is when the capacity drops below critical level, then you run the risk of when people are showing up at the hospital needing that level of care, that there will not be enough beds or enough staff to be able to take care of the patients. And this is not only for COVID-19, but it also pertains to people who will show up for accidents, cancer care, or stroke, and anybody who would need intensive care unit beds. So it's really important for us to be able to try and turn this around before we're past that critical level. The stay-at-home order will be in place for 3 weeks, and it will be reevaluated at that time. Our hope is that that will be enough time for us to see a dip in the cases, and so that we are able to maintain the ICU capacity beds. And then the state will make a decision on whether to lift the stay-at-home order or not. Well, the numbers that we're seeing of cases coming in are very concerning. Over the past couple of weeks, there have been several days, like for example today, where we've hit over 1,000 new cases in just one day. And of course, you know that a certain percentage of those, about 12%, will end up being in the hospital, and a certain percentage of those would need intensive care unit beds. And we know that the numbers are still going up. We have not peaked yet. So it's really concerning as we are seeing this happening more and more, that we would hit that critical level and we'd have to start triaging.
Got it.
It's very difficult, but in general, it will be based on severity. But any doctor who has had to do that will tell you that that's a situation that they would hate to have to get into, because you're basically deciding who will survive and who will not, and that's very tough. The idea of the closure is to stem the increase, to reduce the number of new cases, and that, of course, in part will also reduce the number of cases that will end up in the hospital. The key to remember is that our goal is for people to minimize the trips outside of their home. So anything that is not considered essential, that you need to leave your home, that's something that we ask that you put off. But there are, of course, things like going for medical care, or if you work at a place where it's an essential or critical infrastructure service job, then of course those are the jobs where you would still have to continue working. For employers, for those that are able to have their employees work from home, we're encouraging that they're able to do that. So in terms of businesses that are closed, of course with the restaurants, that would mean that they can only have takeout and delivery. They will not be able to have dine-in. They will not be able to even have service outside of the restaurant on the patio, as we have been allowing. Then you also have family entertainment. All of those will be closed. Gyms will only be able to operate outdoors. The main difference from what we had, say, in the springtime is that, for example, this time schools that are open will be able to remain open. We are also allowing playgrounds to remain open. And also that we've learned from the schools that have been opened that we haven't seen a large number of outbreaks, and that it's we're able to quickly control any outbreaks that occur in those settings. And also the acknowledgement that children should be in school, and they've been out of school for a long time. So as much as we can, whatever we're able to do to allow them to do that, it would be good. Churches can continue to operate outdoors. In Sacramento County, we have put a limit of 100, and the reason for that is we really want to make sure that we avoid large gatherings, and also because when you have a large group of people meeting outside, there's more noise, so it does impact the neighbors. And then casinos, for those that are not on Native American land, those will have to be closed, but this order does not extend to those casinos that are operated by the Native American tribes. And then for the last one was...
We had courthouses and flea markets outside.
So courthouses are considered essential, but I think that they have made changes in how they operate them. Many of them, they're able to do it through video. Or they're able to make additional changes in order to make sure that they have protocols to protect everybody. And then flea markets, for the most part, I think flea markets will be closed. There are a few that have remained open, especially if they're providing like groceries, but for many of them, they will be closed for now. Sacramento County, especially in the winter season, we do tend to see an impact on our hospitals. The difference this time around is intensive care unit capacity, because usually during the normal flu season, what is most impacted is emergency rooms, and then also, again, with the hospital beds. But this time around, the intensive care unit beds are impacted as well. But in general, during the flu season, during the winter season, we do see that our hospitals are quite impacted on a regular basis. So intensive care unit beds are specialized beds. They're for people who are critically ill, for example, those that will need, for COVID-19, things like a ventilator. But in emergency room, that's where people first go when they're going to a hospital. And so what we have seen in the past with the flu season is that you will often see people showing up in the emergency room with different symptoms, but oftentimes most of them are able to get treated and sent home, or some percentage of those are admitted as well, but that does not always impact the intensive care unit beds. This time around, because of COVID-19, the ICU beds are impacted as well. So if you go to our website, our dashboard, we actually provide information on how many of those beds are, the intensive care unit beds and the hospital beds are filled with COVID-19, and then also give you the total numbers. So it does vary. If it goes beyond 30% of COVID-19, then that is also concerning, because that means that that's a lot fewer beds that are available for the regular cases. That's the whole point. And if somebody needs to go to the hospital, they should not hesitate. The hospitals are very safe in terms of the protocols that they have in place to prevent people from getting COVID-19 by just going to the hospital. But we need to make sure that people who need that care are able to get it. So that's why we're taking these measures, to make sure that we still have capacity.